Oftentimes when people think about history, they think of it as something that's past. However, the only really important history is the history that's still alive, that's affecting us today.
Part of the beauty of massage therapy is it's not redefining itself continuously. It's simply advancing and taking along with it its old history.
Massage therapy is the scientific and systematic manipulation of the hands on the tissues of the body for the purpose of maintaining and obtaining health.
I think that people who receive massage on a regular basis start to realize that not only do they get physically better, but they start to evolve as a person, that they become more than who they thought they were.
I think that massage therapy is so important because it allows a person to become connected with where they live. And where they live is in their body.
Historically, the roots of massage therapy run deep.
As defined as massage, the first cultures that used it would be probably Egyptian and Asian cultures.
The Chinese practice of massage goes back to 3000 BC, so it's an ancient and long-standing practice.
All massage techniques date back to China. It goes from China to Japan, it goes from China to Thailand, it goes from China to India, it goes from China to the Mediterranean, and then it makes its way across to the West in Europe, and then in 1856 finally made it to the United States.
Massage was viewed in the Chinese, as in most early cultures, as being something which facilitated real health in terms of physical health, but it also facilitated more spiritual health.
Massage was very beneficial to Asian physicians, or if you would, Asian healers, because now they had a tool of working with people, not working with specific symptoms, but sort of defining what may be going on in the individual's body.
Massage therapist and massage therapy as an application has always been delivered under the banner of comprehensive, under the banner of holistic, under the banner of total care.
Within massage therapy and other forms of bodywork, the influences of China, Japan, and other Asian cultures are still keenly felt.
They integrated the touch in as forms of massage, not called massage, generally called tuna, which is one form, amana, which is another form, or integrating shiatsu, acupuncture, without using needles in shiatsu, or traditional acupressure.
The influence of India also had a tremendous impact on the growth and development of massage therapy.
In terms of India, the influence of India was similar, linking up yoga philosophy, the belief that loosening the joints resulted in the person being a more healthy person, both in terms of spirit and body, that loosening the so-called chakras and that particular energy model was one which could facilitate a much higher level of health.
Greek and Roman influences have also played a vital role in the development of massage therapy.
In Greece, you have Hippocrates, and that's still, remember, massage was a part of medicine, totally integrated into it, until you had a little bit of split around the 50s. So the origins of medicine through Hippocrates, talking about, first of all, do no harm. Hippocrates wrote a book called On Setting Joints by Leverage.
He really understood the benefits of massage, and he prescribed frictions and rubbings as part of medical treatment.
Also in Greece, you have two polarities that wind their way through the whole history of massage, the Apollonian and the Dionysian. In the Apollonian way of looking, the belief is that people are healthy and that life should be lived according to the rule of law and obeying the laws. This was the Apollonian way. On the other hand, the Dionysian way was to believe that healthy life resulted not just from following laws, but that a healthy life resulted from transcendent experiences, from ecstasy, from going beyond one's normal ways of living.
The Greeks used massage as part of their physical fitness routines. They used it before and after sports events.
A lot of medical developments have been with the eyes of keeping the military functional, and massage was one of the forms of military medicine there was much military medicine in China, in India, certainly in Greece and Rome.
The Roman culture provided a lot of access to information. There was a lot of integration of massage therapies, especially for gladiators.
The Romans, they developed some very elaborate bathing facilities called thermae.
Asclepiades is the main figure that's mentioned with regard to massage at that time. Asclepiades believed in that there's therapeutic benefits to bathing, massage.
A Roman doctor of the day looks more like a massage therapist in America now, because they touch, they ask questions, they massaged, they did all types of movements with that person to make a difference.
During the Dark Ages, prior to the Renaissance period, a lot of that culture was, the information was wiped out.
In the Renaissance, there was a revival of the interest in the body and in being beautiful and in the outward expression of beauty. It was a time where people took pride in their bodies again, and so they started utilizing massage therapy.
The person that first analyzed the whole theory, phenomena behind muscle contraction, was Borelli, who was an Italian physician. And originally we thought that muscle contraction occurred by springs, like a spring would lengthen and contract. In fact, the word muscles comes from the word mouse, which means they thought they scurried toward the center and scurried apart.
Those cultures, whether it was the Romans, the Greeks, the Chinese, those cultures understood the value of wellness.
Islamic culture also helped the field of massage therapy evolve and expand.
Turkish baths actually came from the Roman influences, and those Turkish baths are still in place today.
Native American and Hispanic cultures have also impacted the development of massage therapy in the United States.
The contribution of Native Americans in the field of massage therapy is great, namely in their folk medicine, the shamanism. Even the midwives in the North American Indian tribes use massage to help relieve the pain of childbearing.
Curanderas are healers from the southwestern United States, and they were influenced by the Mexican and Spanish cultures.
The base for healthcare in those ancient cultures was based on touch. It was based on massage. It was based on moving the body around.
When you're working with touch, you're working with something that's powerful.
The evolution of massage in America has taken many twists and turns.
Well, when people think of massage therapy, they think Per Heinrich Ling. He was the developer of the Swedish gymnastics movement, and he believed that these active and passive movements would promote health.
As we're finding now, Per Heinrich Ling developed forms of Swedish massage by watching some Tuna massage, by watching some yoga, by watching some of the martial arts or Tai Chi that was used in the Asian culture and some of the fighting concepts of the sword competitions that he was in.
He was a linguist, he was a fencing master, he basically was doing military training, and he himself believed that that there should be a democratization of exercise, that it wasn't just for the military, it really was for the populace as a whole.
Ling's Swedish gymnastics system looks more like therapeutic exercise in today's world. Gymnastics was a form of exercise, stretching, and movement coupled with some hands-on massage techniques.
Anatomy was just becoming its own science, and what Ling did was he married the folklore movements and anatomy physiology, and which was brilliant, and that influence still lives today. And when we teach at massage schools, we teach massage movements and anatomy physiology to give you the scientific basis.
Another country which influenced massage therapy was England.
England's had a lot to do in promoting massage throughout history. There's also been in England a constant incorporation of traditional medicine and what some people may call alternative or complementary medicine.
Massage therapy and medicine have been very closely linked throughout history.
Some of the people who've been most influential in both English and American bodywork are people who had very solid medical backgrounds.
I believe that massage therapy has longer roots that go further into history than any other healthcare practice that we see today.
Massage, with rare exceptions, has been part of the medical tradition, since the Greeks.
The classification of massage therapy techniques into French helped the field of massage therapy evolve.
It becomes confusing for people when they're starting to learn about massage therapy because you've got this Swedish massage, and just because of the term Swedish massage, everybody assumes it was purely Swedish in development that's developed from a combination of cultures all over the world, and it's described with French terms.
When we look at petrissage, effleurage, depotement, all are French terms, but they all indicate applications that are typically associated with Swedish massage.
Johann Metzger is given credit for the French terminology used. He studied the Ling system in Europe. He's a Dutch physician. And again, he actually is given also credit for introducing massage into rehabilitative medicine.
Because Metzger was able to categorize the different types of techniques for the massage applications, it was easier to promote that and explain it to the medical community, so it made it easier for them to apply those things.
The term often associated with Metzger is medical massage. And what Dr. Metzger did was really integrate as part of a comprehensive program for patients the inclusion of massage therapy.
Another pioneer within massage therapy was Matthias Roth.
Matthias Roth was an English physician that studied with Per Heinrich Ling in the Swedish Gymnastics Institute. And what he did is he took the teachings of Ling and translated it into English and published the first English text on the Swedish movement cure.
Two brothers who helped massage therapy gain recognition in the medical community were George Henry Taylor and Charles Fayette Taylor.
Charles and George Taylor were the two people who were given credit for bringing a massage to the United States in 1856. They studied in Europe, and they came to the United States and opened up an orthopedic center, which massage therapy was a major component of it. In fact, within a decade, they had published the first textbook in the Americas on massage therapy. The textbook that the Taylor brothers had written, being the first one in the United States, was influential because it was written by physicians. It gave more of a medical scientific basis for massage.
Because they were physicians, they started utilizing the massage therapy in their practices and then influenced medical massage at that time.
Douglas Graham was a physician about at the time of the Taylor brothers, who came into popularity in massage and was touting it as a very viable physical rehabilitative medicine technique. And his forte was writing. He wrote over 100 articles on massage therapy.
The techniques that were incorporated in Swedish massage are really all of the techniques that are out there. There's probably new variations to concepts, new theories, new forms of applications. But the reality is, so many times, is there's probably no new way for somebody to use their hands.
Early healthcare, early medical care relied on the skills of the practitioner's hands, the skills of the practitioner's observation. This is what early medicine looked like.
Some of the earliest and most profound and scientific and philosophically adventuresome developments were right on the shores of the Mississippi, as you had osteopathy come from Andrew Taylor Still, and Daniel David Palmer came up with chiropractic. both of them very closely related to massage.
I see massage as being woven into the very fabric of healthcare, especially when we look at prevention and wellness.
Another influential pioneer in massage therapy was John Harvey Kellogg.
John Harvey Kellogg was a layperson who loved natural health, who loved natural healing. He developed a sanatorium in Battle Creek, Michigan, and he published a magazine called Good Health that was very well read and well received by the general public. Not only did he have contributions in massage, proliferating massage as a health-building modality, but he is also very big into hydrotherapy.
Kellogg's influence in the way he incorporated massage into the overall program made it look like what we might refer to today as a wellness program. But massage and hydrotherapy, when combined with other allopathic medical approaches, can make a big difference.
World War I and World War II had a profound impact on the growth and development of massage therapy in the United States.
When World War I and World War II occurred, there were numerous opportunities to rehabilitate injured soldiers, and massage therapy was very, very popular back then.
Massage therapy was seen as a form of therapeutic necessity.
Like its connection with medicine, massage therapy was also very closely linked with physical therapy.
What developed was, early on, a real unity between physical therapy and massage therapy.
Physical therapy has always had massage therapy as a component.
Many of the techniques that we see in other therapeutic paradigms, such as physical therapy, occupational therapy, can be traced back to massage therapy and the history of massage.
Massage is really the grandfather of physical therapy. In fact, research shows that Per Ling, who is considered the father of Swedish massage, is also the father of physical therapy. So here we have an inseparable beginning for massage therapy and physical therapy.
Physical therapy in the early 20th century really took over a lot of the rehabilitative role, and at a certain point, clearly it split from massage.
With the advent of new medical technology, as well as pharmacology, massage therapy took a back seat to other healthcare modalities.
One of the things that influenced the history of medicine tremendously was the influence of sulfa drugs. Up until you had antibiotics really kicking in, you pretty much had an equality between the various approaches: osteopathy, manual approaches, homeopathy, massage therapy. They were all regarded pretty much as equals to so-called allopathic medicine, which was pretty much the application of medicines themselves. But when drugs really started to hit it big with antibiotics, they tended to take the front seat. They also tended to take the front seat vis-a-vis their connection with the insurance agencies.
Well, massage therapy kind of fell out of favor in the 1950s, and most of the massage that was seen was actually a front for prostitution.
In the 50s, there was some sense that massage was maybe not quite as legitimate as the people who were dispensing drugs.
Eventually, CAM was developed, which is the Commission on Complementary and Alternative Medicine, through the National Institute of Health, and which started to accumulate and gather information and develop a science of massage therapy.
Another factor which greatly contributed to the growth and development of massage therapy, as well as other forms of bodywork, was the formation of various societies and associations.
The role of associations in the field of massage therapy has had a huge impact on the profession. Originally, we had the American Association of Masseuses and Masseurs that was very gender-specific. In the 1960s, that changed to the American Massage and Therapy Association. Notice I use the word "and." When I first got into massage therapy and joined the AMTA, which is the acronym, it was called that. It was called the American Massage and Therapy Association to include other modalities. Back in the middle 1980s, it changed to just the American Massage Therapy Association, and that term is still used today.
The association provides a forum that allows massage therapists from around the country to share ideas, to debate philosophies, to create new strategies.
Now the biggest organization in massage therapy is the ABMP.
And now AMTA has become more of a medical in its orientation, and ABMP plus other non-associated body workers are holding up not just the medical but the more holistic or new or also new age approaches.
The development of a certification process helped the field of massage therapy evolve and expand.
The introduction of a standardized national certification process has made a huge difference for massage therapy in America. Having national certification through examination provides clear guidelines for massage therapy institutions, for massage therapy schools to design curriculum that will not only meet the demands of a standard, but also be able to expand on those standards in order to meet the demands of a public that insists on qualified massage therapists, on qualified individuals who can provide touch therapy.
The development of massage therapy schools and massage therapy education helped massage therapy evolve and grow.
Massage therapy education, massage therapy schools are the basis for the progress of massage therapy.
In the early 20th century, massage was still part of, as was the case for many, many different medical modalities, was kind of an oral tradition. You generally used an apprenticeship model, and even in schools which were small, somebody would apprentice to another doctor or another osteopath or a senior massage therapist. And so you still had very much the oral tradition operating through certainly the first half of the 20th century. However, you started to have more massage schools existing beginning in the 60s, and then in the 70s they really started to proliferate, and it exploded in the 80s and 90s.
Arguably one of the most significant contributing factors to massage therapy's evolution in the United States was the Esalen Institute.
In the 1960s, with the human potential movement, there was a shift in society's thinking, and people were looking for a higher plane and looking for greater connectedness with each other. And it was through that that massage started to come back into practice. Things like the Esalen Institute, where it wasn't so much about the technique of the massage, but how it connected you with another person and brought you to a higher place.
The Esalen Institute in Big Sur, California, really set the pace for body-mind connection, utilizing as their primary vehicle touch.
Since the 60s and the 70s, there's really been a devotion, at least in some of the people involved in massage therapy and related psychophysical therapies, to say, let's really explore how we can take humans, take the capacities that we have for self-evolution, for self-education, for learning, and really watch these come into fruition. That's the greatest dream. Well, that's a dream Martin Luther King's talked about. That's the dream that John F. Kennedy was talking about. That's the dream that anybody who's deeply involved in the holistic progress of massage therapy is still involved in. And the Esalen Institute were really standard bearers for this quite early on by bringing so many different cultural strands together. Particularly, for instance, they brought together Ida Rolf and Fritz Perls. Fritz Perls was the founder of Gestalt psychotherapy, which is based equally on emotions and an intellectual view of psychotherapy. Ida Rolf was based on looking at osteopathic models and the ways in which you could dramatically change the body. They met at the Esalen Institute and had discussions and basically furthered in a very short time the progress of the exploration into the mind-body connection that's been central to massage therapy ever since that moment.
The growth and development of massage therapy in the United States was assisted greatly by the ideas and approaches of several innovative pioneers.
Ida Rolf was a biochemist, one of the first biochemist females in our history in the United States. she started seeing a relationship between biomechanics and the fascial systems of the body.
Individuals like Moshe Feldenkrais with movement and how that's integrated into how the body responds to gravity gave us an insight on where massage could fit into that.
One of the most influential pioneers in the field of massage therapy was a physician named Janet Travell. And Janet Travell, who was also President Kennedy's back doctor, and the first female physician for the White House, started noticing pain patterns that she called trigger points in the body. Now, the interesting thing about Travell's work is that she created a map that is very consistent from one person to the next. And what I like about her system is it's based on architectural stress points in the body. And what she did was she used needle injections to affect trigger points. And Bonnie Pruden, who was another major influential person in massage therapy, said, I wonder if I can get the same benefits by using just finger pressure. And she did, and she had comparable results. So if we look at the trigger point map, it's very similar to the acupuncture and acupressure maps of China and Japan.
One of the other people who has influenced the history of massage who was not a massage therapist is John Upledger. John Upledger is a osteopath who studied a very particular form of osteopathy called craniosacral osteopathy or cranial osteopathy.
The growth and popularity of sports in the United States provided new opportunities for massage therapists and helped develop the science of massage therapy.
The massage therapists that were using sports massage, many were also personal trainers or athletic trainers or physical therapists. They started looking at sports massage as a way of working in a real-time aspect with athletes, not having tons of equipment available on the side of a sporting event. Say you're at the Super Bowl and you've got somebody who's twisted an ankle and you need to do something as quickly as possible. Massage became an aspect that was favorable.
In the profession of massage, we have a history that allows us to expand on our creativity because we still fundamentally utilize and always will utilize touch.
Massage used to be seen as a luxury or as just a form for relaxation. And now I think people are starting to realize that there's many more applications for massage, that it's not just for relaxation, that it really does promote healing.
I place massage in a very unique and very mobile position. It can operate on both sides of the healthcare fence, both for wellness and prevention.
So a lot of people use massage as a way to maintain health by reducing stress.
I see many times hospice teaching massage therapy for caregivers who maybe would have nothing other to do than sit there and watch a beloved family member pass away. Now they've got this wonderful tool for providing some access to that pathway or providing some sense of comfort.
Massage is probably the most nurturing form of all forms of health care because touch is such a fundamental element for people that touch will have the impact of nurturing. Touch is the agency of care. It's the most tangible way to show that you care.
I think touch deprivation is rising as technology continues to grow. More and more people live in their heads and live inside their technology and are not aware of where they really live, which is in their bodies.
Technology is not the road to salvation. I'm sorry. The road to salvation, or the road to fulfillment of destiny, if you will, has more to do with people being healthily connected to themselves and one another.
The challenges that many massage therapists are facing is defining their role in their particular healthcare and wellness community.
Massage therapy has become more clinical, more specific to needs.
I think the greatest challenge to massage therapists and the massage therapy profession as a whole is educating our community on the benefits of massage.
The hardest part for most massage therapists is going to be in defining Which training is going to be most beneficial for their style of massage?
We've gotten to be known as being more medical, as more credible, as more competent, and probably of all the forms of alternative health, the one that people would question the least, because you don't have to believe in anything weird in order to know that a good massage has very positive and obvious health impact.
As culture changes, massage therapy is going to change with it. It's adaptable.
There's been a constant rise in popularity with massage therapy.
The future of massage therapy is bright. The future for well-trained, qualified massage therapists is even brighter. I see massage therapists as the new general practitioner of wellness.
Massage therapy will probably always be a profession that just continuously evolves. It will take in the new without getting rid of the old.
It's important for us to look at what is health, not just as the absence of disease, but as the presence of a radiant sense of life, of a vitality and a happiness. Life, liberty, and the pursuit of happiness includes massage therapy and the role it can play.